The Ukrainian healthcare system is crumbling due to a lack of progress in reforms, local medical workers have reported. The medical staff in the Ukrainian village of Staiki sighs when asked if the government's reform drive has benefited their hospital. The staff here relies on charitable donations to buy basic medicines and the petrol needed to visit patients in remote areas. I don't know who is drafting and carrying out reforms at the top, or if they have ever been to villages and seen how people live here and with what medical services. For them, it's just the big cities that count. In Staiki Hospital, as in many clinics across the country, much of the equipment is over 30 years old, and paint flakes from damp walls and cracked ceilings not refurbished since Soviet times. Here are their so-called reforms. There are no cars, there's no petrol, but we're still expected to offer care. We must be able to reach a patient within 10 minutes. But how can we do that using the ambulance they provided? Part of the Ukrainian Health Minister Kvitashvili's reform plan focuses on separating the procurement and delivery of health services, a system that up until now has allowed most contracts to be brokered through backroom deals with little external oversight. For example, according to an Anti-Corruption Action Center report in 2013, only 6 out of 6,500 pharmaceutical companies authorized for trading in Ukraine participated in the procurement of HIV drugs, sharing among themselves the market of $30.9 million. The ministry's reform package was finalized in April and brought to Parliament for approval in July, but discussions have dragged on since then.